I'm here at Jack Darling Memorial Park, where it is absolutely packed, quite difficult to even find a parking spot. A similar situation across the GTA. But an emergency doctor we spoke with says it's important for people to take the stay-at-home order seriously as the healthcare system is struggling to stay afloat. There are also now calls to bring in healthcare workers from other provinces to help out here in Ontario.
I think the federal government needs to get involved to help coordinate the transfer of healthcare worker resources from less affected provinces to more affected provinces, especially Ontario. We need ICU nurses here in the GTA to care for the patients that are coming and the patients we have already. Any type of jurisdictional barriers need to be taken down. Premiers need to work together.
Critical care Dr. Michael Warner posted this cry for help on Twitter today as the situation in Ontario continues to worsen. The Ministry of Health says as of today, there are 1,524 COVID-19 patients hospitalized in the province. Of those, an all-time high of 585 are currently in ICUs.
We're using the operating room recovery room for COVID patients now. So there's nowhere to go to recover after surgery. That's why they shut down all the surgeries all over the province. I would say do whatever you can to not get sick in the next little while, because the system that you're coming to is not in good shape.
Emergency physician Dr. Kashif Brazada says the next 2 to 3 weeks are critical, adding there is hope with improvements made to the vaccine rollout in Toronto. Currently, people aged 50 or older who live in high-risk areas can book vaccination appointments online or phone at city-run immunization clinics. The city has also begun vaccinating essential workers where they live in areas with high COVID-19 case counts. Just this morning, Mayor John Tory rolled up his sleeve at a pharmacy to get his AstraZeneca shot.
I hope people will see, first of all, it was utterly without any consequence or any pain of any kind whatsoever. And secondly, understand that any of the vaccines that have been approved, they wouldn't have been approved by Health Canada if they weren't safe and effective.
Dr. Prasada echoes Tory's message, saying vaccine hesitancy continues to be a problem.
We've seen a bunch of people who had the chance to get the shot who didn't, and really they should have gotten it. It would have saved them from a lot of problems. So if you get the chance, get it as quickly as possible.
The message from local, provincial political leaders and medical experts is clear. Get vaccinated if you can. Also, stay home unless you need to leave for necessities like groceries, work, healthcare visits, or school and childcare. Outdoor exercise and gatherings of 5 while physically distancing is allowed. But this was the scene from Trinity Bellwoods Park earlier today. People sitting on blankets and socializing in the sun. A similar situation at Woodbine and Sunnyside Pavilion Beach. Toronto police were out on bikes today and warned they will continue to be on the lookout for lawbreakers.
So officers are going to focus enforcement on restaurants and businesses that are not in compliance with closure orders and customer limits. But we're also going to be attending parks and social gatherings to ensure that individuals disperse, that there are not larger groups of people. And when they are occurring, we're going to educate them that charges will be laid.
Dr. Brazada says if you must leave your home to go groceries or get on a bus, make sure you're wearing an N95 mask, as he says the simple cloth mask won't cut it anymore. He also adds that the COVID-19 variants are much more contagious.